Hello everyone, welcome. Today we'll have a short overview of transesophageal echocardiogram. So let's just waste no time and go to our topic. So as you see, transesophageal echocardiogram is a procedure by which we ultrasound the heart and also the great vessels from a view inside the esophagus. So generally you know that the echocardiogram is commonly done which is called the Transthoracic Echocardiogram, which is done by a probe pressing over your chest. But the problem with the Transthoracic echo is that it does not get a very good view of the posterior segment or the basal segment of the heart, like the left atrium, the pulmonary vein connections, and also the mitral valve are not properly seen, especially if a patient is obese or if a patient has a lot of air in his or her lungs due to diseases like COPD or emphysema, as you might say. But transesophageal echocardiogram actually bypasses this problem and can see the heart from inside the esophagus. So it gets a very close-up view of the heart chambers, especially of the left atrium, because you know that's the most posterior segment of the heart. And it can also see the great vessels, as I have already mentioned. From front, that you can see the arch, it can see the descending aorta. So you can see here is a patient, and the patient is positioned in the left lateral position, and the doctor is first. The patient have to be sedated. Obviously, the patient have to be given light sedation, and then the echo probe or transesophageal echo probe is moved forward through the pharynx and then behind the larynx into the esophagus, and at different sections it sees the different views. Like in the upper sections it can see the arch of aorta, and in the lower sections it can see the descending aorta in backwards and ascending aorta, descending aorta in the backwards, and the left atrial chamber and other valves like mitral valves from this position. So you can see this is the echo probe. This is the echo probe. So this probe can also be placed in the stomach. So it means that you can advance this probe into the stomach and get a view, very good view from the inferior side of the diaphragm, and you can see the inferior surface of the heart very well. And it's shown here that the sound waves are going towards the sonic waves are going towards the heart chambers, and it will create the image that is shown in this picture. So this is the sonic picture. You can see this is the atrium here, and those are the ventricles, and this is the interventricular septum, and those are the valves. Probably this is the mitral valve. So as I have mentioned already, transesophageal echocardiogram is done under very light sedation, and we can see the basal structures of the heart very well, like the left atrium, the appendage, the interatrial septum, the pulmonary veins that connect the left atrium, and the thoracic aorta. So you can see all the part of the thoracic aorta, like the ascending aorta and also the descending aorta. So those structures actually are undervisualized in the transthoracic echo, especially in patients who are obese or in patients who are having a COPD. So those are the classic clinical implications of this procedure. So this is gold standard for diagnosis of infective endocarditis. As you all know that infective endocarditis is more common in the left-sided valves, like it involves the mitral valves or it involves the aortic valves. So they're more common than the tricuspid or pulmonary valves. But the tricuspid or pulmonary valves are more anterior, and you can see them very well in the transthoracic echo. But the mitral valve is kind of the posterior structure. So that's why if the infective endocarditis involves the mitral valve, then it's better to be seen on the transesophageal echo than in the transthoracic echo, because sometimes some patients might have very small vegetations which might not be seen in the transthoracic echo but can be well visualized in the transesophageal echo. So this is a very gold standard for diagnosis of infective endocarditis. As you know that for infective endocarditis, diagnostic measure criteria involves a positive blood culture and also echo finding. So that's very important. And also high resolution images for patients with native and prosthetic valve dysfunction, especially mitral valve, because the mitral valve is kind of a posterior structure. That's why you get a very good view. And also very important is emergency diagnosis of aortic dissection, especially patients who are unstable, because any patients with aortic dissection, if the patient's saturation is unstable, you cannot do a CT. CT is very good, but you cannot do a CT because for doing a CT, the patient must be stable and the patient must be mobilized from the ICU or HDU. But if the patient is very unstable, then you cannot do the CT. So you are left with one option, and that's the transesophageal echo, and that has a very high sensitivity and specificity for diagnosing the aortic dissection. And you can also diagnose congenital anomalies like atrial septal defect, because the septum is also kind of a posterior structure. You can see the intracardiac thrombus, like a patient with mitral stenosis or along with atrial fibrillation might have a left atrial thrombus. And to see that thrombus, the best thing to do is a transesophageal echocardiography. So that's all from me today. Some questions might be that what are the contraindications of a transesophageal echo. The most important contraindications are if you have any esophageal disease, like if someone has esophageal rupture or active esophageal bleeding. Those are the classic contraindication of this procedure. And complications might be bleeding from the esophagus, might be in some cases, though rare. There might be esophageal perforation, but it's very rare complication. There might be compression of structures in front of the esophagus or behind the esophagus. That's all. Thank you very much.
Jahil, di ba yun